Good afternoon and welcome to our Parent Guardian Talk series on coping with loss. We're very grateful to have Dr. Heather Grossman, Dr. Sonali Tatapudy, and Kimberly Mason. So I'm just going to talk a little bit about our speakers. Dr. Sonali Tatapudy joined Hackensack Meridian Health as a pediatric pain and palliative care physician at the Joseph M. Sanzari Children's Hospital at Hackensack University Medical Center in November of 2023. She's also an assistant professor of pediatrics at the Hackensack Meridian School of Medicine, where she teaches about humanism in medicine and social determinants of health. She's particularly interested in the intersection of education, well-being, and communication skills. Prior to joining HMH, she worked as a pediatric palliative care physician at UCSF Bayanoff Children's Hospital in San Francisco and Oakland, California. She also served as the Director of Medical Education for the UCSF Stagg Center for Pediatric Pain, Palliative Care, and Integrative Medicine, and the co-director of the Pediatric Hospice and Palliative Care Fellowship. She completed her medical school residency and chief residency at Mount Sinai Hospital in New York City and completed her Pediatric Hospice and Palliative Care Fellowship training at UCSF. In her spare time, she loves to hike, make up silly songs with her toddler, and explore new recipes and restaurants. Dr. Heather Grossman has been the section chief for the Pediatric Advanced Care Team at Hovnanian's Children's Hospital at Jersey Shore University Medical Center since 2018. Prior to joining Hovnanian's Children's Hospital, she was the chief of Pediatric Hematology Oncology at the Uppenberg Children's Hospital, where she helped to establish its pediatric hospice and palliative care program. She worked as the leukemia specialist at Morgan Stanley Children's Hospital, where she was phase 1 liquid tumor representative and part of the neuro-oncology team. She did her pediatric hematology oncology fellowship at Cohen's Children's Hospital in Long Island, New York. Dr. Grossman also serves as the medical director to the Butterflies Hospice and Palliative Care Program, which serves chronically and terminally ill children. Kimberly Mason has been a senior child life specialist in the Pediatric Intensive Care Unit at Joseph M. Sanzari's Children's Hospital since 2014. Prior to that, Kim worked as a child life specialist in the Pediatric Emergency Department at Mom and Aid's Medical Center. She has extensive experience providing support and education to children dealing with chronic illness and loss. Kim has helped facilitate hundreds of end-of-life conversations for siblings and the children of adult patients through Hackensack University Medical Center. Kim received her master's degree in child life from Bank Street Graduate School of Education. And now at this time, I will turn it over to our speakers.
Thank you so much, Allison. And we want to thank both you and Sarah for putting together this meeting and giving us the opportunity to talk to everyone. We also want to thank everyone so much for joining us. We're taking on a very big topic. So we decided to focus on our area of expertise, which is loss centered around serious illness and death. Fortunately, many of the techniques and coping mechanisms we will discuss can easily be extrapolated to all different kinds of loss that children and young adults experience. We won't be able to get through all the nuances of this vast and weighty topic, but we hope that you will be able to use this information to guide you in helping you and your loved ones better cope with loss. Loss comes in many forms and impacts every age group and every individual differently. So please remember, there's no one right way to approach these complex conversations. The very fact that you're attending a talk like this shows how much you care, and that's a wonderful starting place. We hope to give you guidelines that will help you and your loved ones process their loss in a healthy, open manner. We tried to incorporate some of your general questions by answering them in our talk, and we'll address specific questions later. Our goals for all of us today are that we can help to identify all the different types of loss that children may encounter, although of course the list won't be exhaustive. We can present some universal strategies that help and support children that are going through losses. and discuss some common concerns about how we do this difficult task of talking to children about serious illness and death and other loss, and provide examples of how to talk to children throughout the developmental stages that they go through of serious when and how they can process these types of issues. Next slide, please. There are so many different types of loss that children experience throughout their lives. Preparing them with tools to cope is essential. We have to remember that children form attachments that result in loss that may seem insignificant to us, but are extremely important to them. Anyone who has ever had their child lose their favorite stuffy on vacation knows just how serious this can be. Sometimes those less serious losses can help us to practice how we process and deal with our more difficult losses. Death is probably the most complex of the many types because of its permanence and also our personal and developmental understanding. Explaining serious illness can be daunting and leaves us as parents sometimes feeling avoidant. Well, our children also go through their own set of emotions as they wait to learn about what is happening. Serious illness can change how a child sees themselves. They may become more adultified and have role reversals, feeling like they need to be taking care of their caregiver. They may feel a loss of independence and be more dependent than usual, and they may worry about what comes next and about planning their future and current events. Divorce can also be extremely big upheaval and upset their norms, routines, and a sense of security for children. Moving may mean several losses all at once: their personal space, their friends, their school, neighbors, and even just an important location that they won't be coming back to. And friendships are all important at every age. And when we lose one, it creates a different set of emotions that are sometimes difficult to process. Next slide, please.
So anytime there's a death or a serious illness, your child will benefit from hearing from you directly, just honest and simple explanations. When you initiate the conversation, you are helping to frame what they are likely already observing. Between social media, texting, just overhearing you in the kitchen, there's so many opportunities for children to hear secondhand what's happening. And it's always best to hear directly from you, because that gives you the opportunity to really frame the conversation and help clear up any misconceptions that they have, because chances are what they're picturing in their head and the story they're creating in their head is even scarier than anything that you could tell them directly. So always talk to them first if you're able to. Listening and following their lead. So use your child's body language to really guide you in how much information you give them at a time. We always recommend giving them small bits of honest information to see how they're processing that. And then if they're able to handle a little bit more, then you can give them more details as needed. But just using their body language to really guide that conversation is a great cue. Validating their feelings is one of the most important things that you can do for your child. Telling them that it's okay to feel whatever they're feeling, because grief looks different for everybody. So sometimes you might be angry, sometimes you might be really sad, and other times you might just want to play. And wanting to play or socialize with friends, that doesn't mean that they're not grieving. That's their way of going into self-preservation and saying, okay, I've had enough of what I can handle in this moment, and I'm going to do what I need to do to get me through to the next moment. Kids have an amazing ability to be resilient and be able to recognize when they need that. It's great to have a healthy outlet like art or play or physical activity, because especially young children, they don't have the ability to always verbalize what they're feeling. play is the language of children. And so giving them opportunities to play, to do art, to do something familiar in a way that allows them to express themselves, that is always going to be helpful. And it's also a great activity to do to just have them transition to after a difficult conversation where they might not have those words to express themselves in the moment. And then maintaining routines. If you are able to keep them in school, if you're able to have one point person to pick them up, that's always something that's going to be helpful for them. Consistency and maintaining routines allows them to just have a little bit of control and to know what to expect. Next slide.
So now we'll pivot to talking a little bit about the specific type of loss that the three of us regularly encounter in the hospital setting, which is really about coping with death and serious illness. And next slide, please. Oh, actually, sorry, one back. You can go back one. Yeah, there we go. Okay, next slide. There we go. So before we can advise on how to talk to children, first we really need to examine our own selves, right? And I think one of the things that's really most important to think about, and you see here in the picture, this idea of the elephant in the room, that we all come into all of these conversations, whether it is about death or serious illness, or it's about any of the major transitions a child might experience in their lifetime, with some of our own baggage, right? And a lot of that comes from the culture that we were raised in, whether your family or your culture growing up was one in which you openly talked about things like serious illness or death, right? Western culture tends to be very death phobic, right? We're scared to talk about those things. And as a result, sometimes we're not fully prepared for these conversations ourselves, let alone figure our children about them. And one thing that's really important is to really center ourselves before having these conversations with children. Because when we avoid the hard stuff, when we avoid those difficult conversations, we're passing on to our children or to young ones in the family that they should also avoid the hard stuff, that it's not okay to talk about these things. And we talk about this really frequently in palliative care, this idea of something called mutual pretense, which is that everyone knows that there's an elephant in the room, right? Children can sense that something is different, but nobody's talking about it, usually as a way of protecting each other, right? And quite often that's, from a sense of, I don't want to take away their hope. I don't want to make them sad. I don't want to take away their innocence or their childhood. It comes from a place of loving. And quite often actually opening things up and being able to create a safe space for children to ask questions, to be able to clear up their misconceptions. Like Kim said, quite often children might be worried about something that's actually much scarier than what might actually be happening in the moment. Right? So the more that we can bring these things out into the present, into the open, and by first kind of recognizing what our own feelings are about any particular subject, it can make a really helpful atmosphere in the home setting. Next slide, please. So in order to do that, we have to really trust in the resilience of children, right? And just like I said, those fears of taking away a child's hope, taking away their innocence, or a sense that they won't understand anyway, all of those come from love. And being able to reframe for ourselves that actually that openness and being able to talk about death, being able to talk about serious illness, being able to express emotions can actually help to clear up misunderstandings, can help with coping. And it's really true. We've seen in our own sort of clinical experience, and it's studied as well, that children have an amazing capacity for resilience and self-preservation. All right, next slide.
So focusing on that resilience, we want to dig a little deeper into coping with death based on our understanding about children's brain development and what they understand as they grow and develop throughout childhood. The following information and developmental concepts are in the context of talking about serious illness and death, but many of the points around how children may react or how you can help them are generalizable to all losses as well. You may notice that some of our talking points have a star next to them. These mean that These events are very common, and they are across, and they can be seen across all age groups, not just the specific one we're referring to at the time. Next slide, please. Next slide, please. Great. Okay, thank you. So infants and toddlers, a personal favorite of mine, they experience the world through sensory information based on physical needs being met. So we often think, oh, they're too little, they don't understand what's going on, I don't have to talk to them about it, I don't have to address it. But that's not true. Children do sense loss, and it's an experiential loss, probably more so than at any other age group. They react, the way that they react is sort of true in how this age group acts across any type of stressor or challenge that they face. So they may cope with by mimicking what they're seeing others do. They often regress, and that can be across all different ways of expression. It can be using baby talk when they were speaking in full sentences. It can even be mutism, where they're choosing not to talk at all. They can have disruptions to their sleep. They can choose not to eat, or become very picky when they were very generalized earlier, or eating more often, or choosing the wrong things to get attention. They may also regress in potty training. Somebody who is fully potty trained may start having accidents. They may need extra attention and extra time. They may start acting out. And so it's important to remember to strike a balance. Just because we know the source that somebody is acting out around doesn't mean that we still don't have to set limits. And part of being normal and having the normal routine is not accepting unacceptable behavior despite the loss. You can help by making sure that things stay the same as much as possible, by keeping their routines and their schedules, allowing them to participate in the things that they enjoy. As always, and we're going to say this over and over again, answer their questions honestly, directly. In this age group, it's important to use short, age-appropriate words. And remember that it's completely normal for kids of this age group to ask the same question over and over and over again. It's not because they're not listening, and it's not to drive you crazy. It's reassuring to them that they're getting the same answer. You want to always provide warmth and comfort, and they may need some extra time where you're not just physically present, but totally present and helping them to be just together. As I said, you need to still set some limits, but have some flexibility and take into account what they're going through. And then it's super important that we remember to include all the people that care for the child about the loss that they're experiencing. So you want to notify daycare staff, babysitters, nannies, anyone who might come in contact with them to help as be part of their village and support them through the loss. Next slide, please.
So now let's talk about preschoolers. What do we know about preschool aged kids? So, for them, the concept of death is changing a little bit, right? They can understand a little bit of what the word death means, but they think of it as reversible or something temporary. And especially because sometimes a person who has died might look like they're asleep. They might view death as sleep and ask things like, when are they coming back, right? They might believe also they have, incredibly powerful imaginations. And for the most part, preschoolers often think everything is about me, right? And with that powerful imagination also comes some ideas around magical thinking, right? So they might sometimes feel like they might have caused something to cause the death, right? Like, one time I was really mad and I wish she was dead, and look at that, now she is. It's all my fault. And so that it can be very, very common in preschool age children. And in terms of how they might react, many of the things that Dr. Grossman just said are also applicable to preschool age children, right? They might have regressions. They might have disturbances in their eating or their sleeping patterns. They might have more tantrums. They might be really, really attached to you and not want to go to school or want to just not leave your side because they're worried. Like, that someone has died. What happens if, you're not there to pick them up? They don't yet have the language to express their grief, right? And so they might ask a lot of why and how questions. And you also might find yourself answering the same question many times, right? In the same way that they might believe that the person who has died might be coming back. They might need to hear it many, many times to really understand what has happened. And it's not that they're trying to drive you crazy. It's that they just need to hear it many times to know. And the other thing is that they can sometimes appear unaffected by the death. And for families, this can be really scary or disturbing sometimes to be like, oh, my child doesn't care. And it's truly not that. It's that, just like Kim said, they have an amazing ability for self-preservation and can toggle back and forth in a way that sometimes we as adults have a hard time with. And so you might notice that they might appear unaffected at some points and then have intense grief reactions at other times. And this is true of children across the board, but especially true in this age group. There are many ways that you can help. So using simple, honest explanations and really using words like death and die, concrete things, right? Rather than using euphemisms, because if you use words like we lost them or they've gone to sleep, that can be very confusing for a child this age. And we'll talk more about that later. Really giving them options for creative play, active play, and including them in any rituals that you might have as a family, right? Doing something concrete can be extremely helpful for a child this age. Keeping familiar routines, and then making sure that anyone important in their life, whether it's school teachers, if they're in extracurriculars, anything like that, also know, so that you can provide wraparound support for your child. Next slide, please.
So children really begin to understand the permanence of death between the ages of 5 and 7 years old. They may have a very big varied reactions, but children at this age can also still have magical thinking, where they still think that they were bad or they did something to cause this. So always telling them that this was not your fault, you didn't do anything wrong, is really important to emphasize at this age. School-age children are also very curious about details of the body and what exactly happened and why. So again, follow your child's body language to see how much they can handle in the moment as you start to give them some of the answers to those questions. But if they are asking, it's always best to answer simply and honestly. They may wonder if they will get sick and die too. One of the things that I like to say is that, sorry, I just lost my place for a second. This person may have had something, but it's not contagious and it's not something that you can catch. I see this all the time with parents who have had cancer, when kids will ask, is this something that I'm going to get tomorrow as well? So just clarifying for them that this is something that they can't catch is very, very important. You can also say that most times when people get sick, if you or I were to get sick, there would be a medicine that you can take to get better. What this person had was very, very different. So just being able to clear up those misconceptions. Grief may look like misbehavior. So it is very, very common for kids to act out, whether they're a young child or a teenager. When they're going through a lot of big feelings, you might see anger coming out in play. You may see your child smashing superhero figures together and crashing their cars. Let them play it out. Let them express themselves however they need to in the moment. Try not to stop that play, even though it can seem very aggressive sometimes. It's good for kids to express themselves in any way that they can that is normal for them, whether it's through art or through play. You can also help narrate some of the feelings that they're having. Like, it can be really frustrating to see your mom in the hospital for so long. It's normal to be angry that this is happening. So just being able to call out some of those emotions. Participating in goodbyes and rituals is very, very important to children. Whether it's attending a funeral and being able to put a flower on a casket, or releasing balloons. Allowing your child to be part of the goodbye and a part of the ritual can also give children closure. Informing caregivers so they can support you and your child. Especially at school, anybody taking care of your child throughout the day, letting them know what is going on is important. That way they can look out for any signs that can be concerning. And they can also give a little leeway if your child is not feeling themselves. But letting anyone who's taking care of your child know what is going on can really help just give your child a little extra support. Next slide, please. Next slide. Thanks.
Sorry. So the dreaded teenager is next. Everyone knows that communicating with teenagers under the best of circumstances is difficult. So talking to them about things that are deeply personal and painful is even more taxing. But there are ways to get through. This age group is unique in that they're struggling with forming their own identity, and they're capable of abstract thought and understand that death is permanent. They get that everybody dies, and they have the concept that they will die as well. But as most teenagers think they're invincible, they think that this possibility is very far off in the future and not really relevant to them in the here or now. So facing death at this age is particularly anathema to young people. Teenagers may try and really become the adult and approach death by mirroring what they've seen adults do, as even in movies or with their own family members, and they may express sadness or guilt or anger or almost any emotion that you can imagine. They often will look for guidance from others to try and make sense of the whole thing and figure out what happened, why it happened, what their role in it happening was. It's normal for teens to talk or to be with friends or other people who are not family to process. In fact, they often need to step away from the immediate space where there is so much grieving and distress going on, so that they can focus and that they can feel some of their own emotions. They might use humor and laughter and that time with friends to help them cope and to help them offset some of the overwhelming emotions that they're experiencing. At this point in their lives, they struggle between their identity as a child and as a grown-up. And so they may see this as an opportunity to have a greater sense of responsibility. And now they take on that responsibility and feel like they're the person who might be responsible for protecting or caring for the family, or filling in gaps that are left behind from losses. It's very important to be aware that some teenagers will engage in increased risk-taking behaviors as they process their grief. So if you know the teen, and again, if we let other people know and you see them engaging in something that they wouldn't have otherwise done that's high risk, or even something that they would do, but they might be more reckless about it as they're processing their grief. So be aware and be present. They might turn or even question their spirituality and how the loss fits in with their developing understanding of faith and justice and fairness and how the world works in general. Grief is extremely personal, and it looks different for each teen. So, as we've said over and over again, the most important thing you can do is listen when they're ready to talk, not force them to talk, not coerce them to talk, but be present when they show a readiness to talk about their thoughts and feelings. And then make sure that they're validated in those feelings, whatever they are: anger, frustration, guilt. You have to give them a space to feel what they feel and fully express themselves. And again, the repetition of the idea of including everybody who's a part of your child's team is super important, because they may need tools to help to speak to the child with this new information, with this new loss. And so if we can all work together as a team to help support our adolescents and young adults when they go through loss. And importantly, and this is true at all age groups as well, if your teen shows signs of increased distress, such as depression, severe anger, suicidal thoughts, or any unsafe behaviors, or something that's just concerning you as a loved one who knows them well, it's super important to seek professional help. I really think that there should be like a disclaimer at the beginning of any talk about health and wellness, that mental health and wellness is part of that whole being, and that loss is not it's part of normal life, but it's not part of our everyday life. And having psychosocial support for it, I think, is extremely valuable and important. And I would wait for those signs of severe distress before I sought help. And I tend to counsel my patients and my families to seek out support groups and therapy whenever they encounter a loss. And this could be more true for the adolescents if you can get them to agree to it. Next slide, please.
So helpful language. You can start by saying, this person has died. When someone dies, this means that their body has stopped working. When your body stops working, you can stop breathing. And when you stop breathing, that means you die. So using very clear, simple language with children, because they're very literal thinkers. If you use, you should always try to avoid euphemisms when possible, like we lost, they went to sleep. If you say they went to sleep, your child might become afraid of going to sleep at night. So just trying to avoid some of those phrases and say clearly that this person has died. There's a lot of security statements that can be helpful as well. I'm here to listen to you, or we can sit quietly together. Just being able to hold the space for your child and sit next to them without having to say anything at all, you're showing that you're there for them, that you are going to support them, even if they don't have words in the moment. Another thing that you can say is, no matter what happens, we are still a family, and you have so many people here who love you and are going to continue to take care of you. Another sentence that can be helpful is, it's hard to say goodbye to someone you love. It's very normal to miss that person, and that can look so different for everybody. So whether they are crying, whether they just want to play, let them know that whatever they're feeling is okay. You can model for them, I'm feeling sad right now. How are you feeling? Talk about what you're feeling. You don't have to hide that for children. A lot of times parents feel the need to protect their children, and children want to protect their parents just as much. So being open about your feelings is going to help them be able to express theirs. There are going to be questions that your child asks that you don't have the answer to, and that's okay. Telling them that that's a really good question. There's no such thing as a silly question. I don't know the answer to this, but I'm going to help find out for you. That shows them that what they're thinking about matters. It's giving them that respect to be able to just keep them as informed as possible, so they feel in as much control as they can in a very out of control situation. Next slide. So legacy making activities. Memory making activities can help families tell a story and provide opportunities to express how they feel. It's an act of taking the time to purposely create something for a loved one. And that could be whether it's the child making something for the person who they are losing, or if it could be a parent making something for their child. I've done hundreds of family handprints in the hospital at the bedside, and it can be a really beautiful activity to just help hold the space after a really hard conversation with a child. It's also a really nice activity to just take some of the tension away from everything that has just been talked about, and it gives that child a tangible item to take home. It can be a final activity for the family to just do together. Photos. I always encourage, in cases of anticipatory grief especially, take as many pictures as you can of that person. Don't worry about if your hair is messy or if you don't look perfect that day. All your child is going to care about is the love in those pictures. For videos, there's so many opportunities where you can just take a simple video on your phone. You can take a video of siblings reading to each other. You can record a video for your child of something that you want them to know that's really important to you. But use that time, if you can, to record anything that they can watch later on that is really going to remind them of that person. Art projects. So this can be daunting for some people. You don't have to be a crafty person to lean in if your child likes art. There's so many simple prompts that you can do. You can hand a child some paint and just a rock and say, would you like to paint something for this person? Would you like to make something that we can hang up in their room? There's so many simple activities that your child can do that will give them a feeling of they're helping to care for this person by making something for them. And vice versa, you can also make something for your child. I've painted little wooden butterflies that I've gotten at the dollar store, and parents have made that and hung it in their child's window. Just simple items. There's so many ideas out there if you go on Pinterest that you can find. Letters. So for cases of anticipatory grief, this is another beautiful thing that you can do for your child. I had a young mom with metastatic cancer, and her daughter was 3 years old. And what she did was she wrote a birthday letter to her child for every year until her child turned 21. And that is just such a priceless gift. So just a few words of wisdom or favorite stories that you have that you really would love for them to know. And then recipes. This is cross-culturally, cross-generations. I think that recipes are such a nice thing to hand down because it is such a sensory memory. You know, if you have a memory of cooking with your grandmother in the kitchen, her favorite food, that's something that can always transport a child back to those good moments, those good memories. And so if you are able to, make a recipe with your child of whatever it is that this person loves, and that's something that they are going to have forever. Next slide. So we are in the process of finalizing a resource that just goes over everything that we talked about. I know this is a lot of information, so this will be a condensed version that will help give you a script of how to talk to your child based on their age. In the meantime, we have these QR codes that are going to link to a curated book list of books about loss by age group. So you can use these QR codes now, and then when that resource is ready, we will email it to everybody who registered for the presentation today. Next slide.
In the interest of time, I'm not going to go over all of these wonderful resources that we put together for you, but we did divide them into the southern region and the northern region and some specific ones for pregnancy loss. This is not even the tip of the iceberg in wonderful groups. We didn't include on here Good Grief. There's so many excellent resources. Feel free to reach out to us if you have any additional questions or any would like us to help you get in touch with any of these places or identify more resources if you're experiencing any type of loss. Next slide, please.
So in summary, we've talked about several really important things here. And I think one theme, hopefully, that you've heard running throughout our conversation is that, while the tips that we shared are specific for serious illness and death, many of them are very generalizable to all types of loss a child might experience. And what are those things? It's that open communication, honesty, and providing outlets for expression are key in helping children cope with loss. Recognizing that every child processes differently and trusting truly in the resilience of your children, knowing that your support and the fact that you are there, the fact that you are here watching this webinar, that is going to give your child the tools that they need to cope. And just a brief reminder that there's no getting over grief, right? This is all part of a journey. There's only getting through it. That's true with any major transition, that as we handle everything that comes our way in life, there are ways that all of these lessons can be applied in a way that makes us stronger, more resilient as we go through life. And that's the goal, really, of all of this. Next slide, please. So we wanted to make sure that we saved enough time for some Q&A. So we'll be transitioning to that next. So don't go off the webinar yet. But before we do that, we just wanted to give out some thank yous, really to the patients and families we've had the privilege to serve, the really hardworking Child Life team and the pain and palliative teams at both the Southern and Northern hospitals in the HMH system. Hania Thomas Adams, who is a child life specialist at UCSF Benioff Children's Hospital in Oakland, who provided some of the material for our slides. Sarah and Allison, who just did an incredible job putting everything together, and for all of you for attending. We can now move on to some of the questions. I know several of you had submitted questions beforehand that we've kind of looked through, and any new questions, please feel free to keep them coming.
Thank you so much. That was very helpful and just a wonderful presentation. So now we will get started with some questions that were submitted. The first one, how to answer a child between the ages of 5 and 10 when they ask, are you going to die and are you sick?
So one of the first things that I think is true about all questions when they're coming from that toddler to school-age child is don't assume that what they're asking you is what they really want to know. So the first thing that I say when I get that type of question from a younger child is, why are you asking? What are you concerned about? And sometimes you'll find out they're asking a very different question than what you think they are. So you don't want to answer something that they're not actually asking because they may not be ready for that information. But if they're truly asking, are you going to die? I do still believe in an age-appropriate way and a straightforward, honest answer saying that sometimes people that have what I have do die. And then stop and wait for them to respond. And if they get quiet or they're not continuing the conversation, you can open up the conversation further by saying, how does that make you feel? And what would you like to talk about that? Or what are you worried about? I find that gives those open-ended questions that aren't assuming what the nature of the question is very helpful with the younger and other age groups.
Another thing that I like to say when kids ask this question is, you can say, the doctors have been giving me lots of medicine to try to get me better and to try to get my body stronger. Sometimes it's hard to find the right medicine that will work, but we are doing everything that we can.
All right, thank you. The next one is, what type of resources are available for children, families that have children with neurodegenerate disorders like ADHD, ASD for grief? How do you assist families that have specific cultural and religious needs that may create a barrier to care?
This is a phenomenal question, and I, in a bigger picture, would defer to some of our colleagues who treat ADHD and ASD. But there are a couple key points that I think are important to know, that children with neurodivergent disorders may experience grief and have an increase in whatever their symptomatology is. And they also may be more reluctant to take their medications controlling those issues. And therefore you'll have sort of a much greater sense of what, a much greater symptomatology. And so that can be really, really difficult for us to watch and to try and manage as family and loved ones. But in knowing, if you know that at the start, you can be more on top of that and have more frequent visits and be aware of what they may happen. also when you're, as sort of a sub question about the cultural and religious needs, I find that in my job, I'm constantly learning. And one of the things that I always want to learn about is what's important to families culturally and religiously. And that we have to remember that while we all have different belief systems and that we may identify with a specific one, the way that we practice personally may be different. And so really learning and understanding what's important in that family structure regarding culture and religion can be very important, and reaching out to some of our wonderful religious groups. So if you're affiliated with a religious group and the child is also very involved in that religious group, there's often a support group within that community that can be very helpful and have a shared type of support.
Just to add on to that, right? I know part of the question was also talking about sometimes cultural or religious needs might feel like they're creating a barrier to care. And I just want to acknowledge that, different family systems, cultural practices, religious norms, all of those influence how we talk about death and how we approach death. And there's often a really fine balance to try to help balance kind of what's best for the child and what questions they have and how to answer them, with also what's best or accepted in the community. And so a lot of what we do sort of in our work, but also what you'll be doing as family members, is really thinking about how do you balance those sometimes competing needs, and think about, how to fulfill multiple niches at once.
And we always try to meet families where they're at and model healthy ways for them to help their children express what it is that they're feeling. I have found that, cross-culturally, death is such a hard thing to talk about in general, even with other adults. And in many cultures, they don't acknowledge it with children that much. And so that's something that I think is very common across the board. And so just helping parents to have the language to be able to talk to their children about these really difficult subjects is so important. And we model that anytime we can.
All right. The next question is there any benefit to preemptively discussing a grandparent's illness with preschool and elementary age children?
Yes. I think it is always, always helpful to discuss this with children whenever you are able to. It allows for the child to really process some of their anticipatory grief. And it also can allow for opportunities for legacy making, to really start working on some of those tangible items that they can have, that they can keep forever. So I think that whenever you're able to start that process, it's always helpful to start sooner rather than later.
Yeah. And, similarly, I think prep is always helpful. And whether it's about something like preemptively discussing an illness, or maybe someone who's getting close to the end of their life, and even sort of what we might consider as adults to be sort of smaller transitions. But I can tell a small story, which is that my toddler recently, we were going to visit my sister-in-law's dog, who had been sick recently and had a major surgery. And really just prepping her in the car of what she might see when she visits, what might be different, what to expect, like all of the ways that kind of her experience might be different, really helped her. And she was able to sort of repeat back, she's 3, but she was able to repeat back sort of, oh, Wiley is feeling sick. And, that means I can't pet her in the same way. And Wiley, no jumping, right? But all of those things kind of helped her make sense, rather than sort of being scared when she saw that the dog that she knew was very different, looking very different at that time. So prep in general, I think, is always, there's no such thing as too much preparation.
All right. The next question is, my husband recently took his life. I have 3 children, ages 20, 16, and 14. My younger children will not speak at all about it. How do I support them through this?
So I think, this is such a great question. This is a really hard thing. Feelings of guilt and betrayal are very normal for kids to have in this situation. And so I think validating that whatever they're feeling, it's okay to be feeling that way. They did not do anything that caused this. That this is a really, really sad thing that happened, but they didn't do something wrong. It's so hard to tell them to not feel guilty when you know that kids internalize just as much as adults do, and a lot of times all of those feelings. So just letting them know that this was not their fault and that it's okay to be angry. It's okay to be angry that they're not here anymore, and to ask them, like, what makes you feel better when you're angry? What can we do together? Just showing them that you're there to hold the space for them. Again, just they don't have to talk about it. Forcing them to be even more vulnerable than they already are is not the answer. But I think leaving room for just letting them know that when you are ready, I'm here.
And I just want to say how very sorry we are for your loss.
Mm-hmm.
And everything that your family is going through. But I hope that some of what we talked about for adolescents, not necessarily wanting to talk about it, makes you feel less worried about your younger children who aren't talking, because that may just be what they need right now to try and process such a huge upset in their life.
Yeah, and that being said, I think, in general, family therapy can be sometimes a really helpful way to be able to engage everyone together and give you a space sort of outside of your internal family system, someone else who can hold that for you. So definitely a helpful resource.
All right, the next question. At what age or time frame would it be appropriate for a child to visit the gravesite of a deceased family member? If they ask to go, does that mean that they are ready?
I would say yes. If they're asking, then absolutely. Involvement in rituals before or during the end of life process, afterwards, all of those things help kids process. It helps them feel useful. It can help with the overall grieving process, especially if they're feeling interest, like expressing interest. If a child is not showing any interest or in fact is like reluctant to enter the room or worried, I would say, follow their lead, like we've said several times in this presentation. But generally, it's true in the opposite direction too. If they're expressing interest, absolutely, kids of all ages can and should be included.
And in allowing them to explore with that interest, we're taking away some of the fear of the unknown, which is super important. And also, we make different places like graves taboo. They don't have to be. And if we normalize it, it can be very helpful for everyone's grieving process, and really make going to the cemetery or doing those things very meaningful.
The next question, it's actually a couple questions combined, but how do you help younger children, understand and deal with the loss of a loved one that they may have never met, navigate the conversation, and also maybe not even a family member?
So I think one thing that you can do is you can use opportunities to share memories about that person if they bring them up. I can tell you, my daughters were 3 and were 4 and 2 when my sister passed away, and they don't have any real lasting memories of her at that time. And so sometimes they'll bring her up and it always takes me by surprise and it's hard in that moment, but I always try to bring it to a good memory of her that they can really relate to. And so the other day I was outside and I was looking up at the leaves and I said, did you know that Auntie Tiffy loved leaves? And my daughter picked one up and she said, oh, I'm going to hold it up to the sky for her. And it was just such a beautiful moment. And so there's, I think, a lot of opportunities to just share memories of that person, so they can know them through you.
Thank you. The next question, how do you care for your mental health as you work in this field and help others cope for loss?
So I always think it's good to look for things that bring you joy. And I have a ritual of every single Wednesday, I make it a point to do something for myself, whether it's going out to dinner or just taking an hour to do something that I'm really, that's going to help me relax. But I find that doing something midweek on a Wednesday, it just helps you get through the week. It helps you get to the weekend. So it's a nice break to have that.
I think that self-care is super important for everybody. If we're not good to ourselves and we're not feeling our best, we're not good at providing care for others. So it's important to try and recognize when we're affected by the work that we do. And when I've had particularly bad days, my favorite thing to do, and on a regular basis, is to go for a run with my dog in the woods. The woods is my happy place, and I feel like I can center myself and process what I'm feeling and the losses that we feel, because as caregivers, we also grieve for our patients and their families, and it's important to have a place to put that. And as I said earlier, I very strongly recommend mental health care as a wellness imperative and something that we should all be focused on.
Yes, absolutely. I think we, especially in palliative care, some of the things that are often taboo in general culture, we actively embrace in palliative care. And I think talking about the importance of, for ourselves, being in therapy to be able to process the loss that we see is so important, and to not have that be a taboo thing. I think, as a person who works in palliative care every day, I feel like one of the questions I get most often is like, how do you do this? It's so sad. And I think for me, I've always found a lot of meaning and connection, right? Being able to connect with families at such critical and tender times in their lives gives me a lot of purpose. And I really feel like I'm a better person every day because of the work that I do. And just like Dr. Grossman and Kim both said, the heaviness does sometimes weigh on you. And so for me, it's through regularly practicing meditation, getting out in nature, and remembering that I'm part of something much bigger, spending time with family, and finding really sources of just awe and joy and gratitude in everyday moments. That helps me to stay grounded.
All right. We have a question that was submitted. How do we make a child of divorce feel loved when one parent is disparaging the other?
There were a couple of questions about divorce, and the first thing I want to say is that almost everything that we talked about is generalizable for divorce, because divorce is a form of loss, right? It's a loss of your parental and family unit that's changing. So some of the techniques and approaches that we've talked about are super important. The other thing in divorce is you can't control all of the narratives, correct? So like when you're thinking about somebody else being disparaging, you may not be able to change the other person's behavior, but you can continue to instill in your child your values and the importance of kindness and support versus disparaging. And it can be very, very hard, especially when we're feeling attacked ourselves. But I think it's the healthiest thing for the child to see somebody modeling kindness and unconditional love for that child.
And I think it's also good to just acknowledge this with your child and say, sometimes parents don't get along, and that's okay. That does not take away any of our love from you. And so just letting them know that you will always have multiple people who love you so much. Even if mommy and daddy don't love each other in that way anymore, that does not take away how we feel about you.
Thank you. Another question that was submitted: what type of anger outbursts are considered normal, and what behavior may be more of a cause for concern?
I think any behavior where your child might be talking about hurting themselves, anything that is that is much riskier than they would normally do, I would always seek professional help in those cases. Little outbursts where a child is crying or a child is yelling or they might throw something, it's important to set limits. If you see them throwing something, if you see them doing something that can be a little bit destructive, but that is very normal for the course of grief. I think that everybody reacts very differently, but it's normal across the board for kids to not be able to control their emotions sometimes, especially when you're dealing with something as big as the impact of a major loss in their life. But definitely anytime that you become concerned that they could potentially do something to hurt themselves or someone else, always seek professional help.
Yeah, and generally I would say that you are the expert at your children. And so you have a sense of how far away any particular behavior is from their baseline. And so if you're seeing something that's worrisome for you, it's always helpful to just talk to someone and check in.
Thank you. And we are over time. I'm just going to ask this last one. Is there a list of therapists that you may have that just specialize in grief therapy?
So because the therapist's coverage is based on your insurance, often what we do is do an insurance search. But one of the things you can do fairly easily if you're looking specifically for a grief therapist is on like Psychology Today, you can put in that they specialize in grief and find somebody in your area. I won't know whether or not they take your insurance. So that's something that it's easier to do on your own or on a one-on-one basis rather than a blanket list, because the list is fairly extensive of people who do this work.
Thank you so much. Thank you so much. This was very helpful, informative, as much as it is a hard topic. You guys did a wonderful job explaining everything, answering questions. So I really appreciate Dr. Grossman, Dr. Tatapudy, and Kim for joining us today, and for all of you for joining us. So please watch your email for an evaluation of the program. Please take time to fill it out. We want to hear from you, and also let us know if there's other topics of interest. The recording will be included, and you can listen again or share it with others. Our next upcoming Parent Guardian Talk series is on April 30th, and the topic is acting out from toddlers to teens. And on May 30th, we will have a program for new moms just not new moms, any moms, on motherhood and the mind. So we hope you'll join us for other upcoming programs. You can always visit our website at Hackensack Meridian health.org/events or call 1-800-560-9990 to register and find out more information about these upcoming programs and others. So thank you all again. I hope you enjoy the rest of your day, and thank you for joining us.
Thank you very much. We appreciate it. Thank you.
Thank you.
Thanks, everyone.